Please everyone have a seat. We're getting started in a couple of minutes. Please everyone have a seat. We're getting started in a couple of minutes. مندوب سمو الأميرة منى الحسين المعظمة، معالي الأستاذ الدكتور فراس الهواري وزير الصحة الأكرم، أصحاب المعالي والسعادة، السيدات والسادة الضيوف، الحضور والقائمون على هذا الحفل الكريم، السلام عليكم ورحمة الله وبركاته. أهلا وسهلا بكم في هذا المؤتمر الإقليمي. في البداية أعرف عن نفسي، أنا محدثتكم من الشبكة الشرق أوسطية للصحة المجتمعية امفنت وجين الحراية. يملأني الفخر أن أكون عريفة هذا الحدث الهام. قبل البدء، خير ما نفتتح به حفلنا هذا آيات الذكر الحكيم يتلوها علينا السيد عبد الله الشاهين، فليتفضل مشكورا.
السلام عليكم. أعوذ بالله من الشيطان الرجيم. الله نور السماوات والأرض، مثل نوره كمشكاة فيها مصباح، المصباح في زجاجة، الزجاجة كأنها كوكب دري يوقد من شجرة مباركة يوقد من شجرة مباركة زيتونة لا شرقية ولا غربية يكاد زيتها يضيء ولو لم تمسسه نار نور على نور نور على نور يهدي الله لنوره من يشاء ويضرب الله الأمثال للناس والله بكل شيء عليم.
إذن يشرفني باسم امفنت أن أرحب بكم في هذا المؤتمر الذي يقام تحت شعار تعزيز التأهب والاستجابة للصحة العامة، التحديات والفرص وسبل المضي قدما. قبل البدء اسمحوا لي أن أدعوكم للوقوف في دقيقة صمت إجلالا واحتراما لأرواح الشهداء ومن فقدنا من المدنيين والعاملين في مجال الرعاية الصحية في مناطق الحروب والنزاعات وفي مناطق الكوارث الطبيعية، خاصة في إقليمنا الجريح، ولأرواح المستضعفين في العالم عامة. أيها الحضور الكريم، يجمعنا هذا المؤتمر اليوم لنجسد التضامن بين شعوب إقليم شرق المتوسط ولنتحد لمواجهة التحديات الصحية التي تعصف بالمنطقة. التعاون هو سبيلنا الأمثل للتغلب على هذه التحديات ولتحقيق الأمان الصحي لشعوب المنطقة. هذا المؤتمر ليس مجرد حدث علمي، بل هو منبر للبحث والتفكير في كيفية التصدي للكوارث والأزمات التي تعصف بالإقليم والتي تقتضي منا خاصة اليوم اتخاذ خطوات حاسمة واستراتيجيات مبتكرة في ظل ظروف عصيبة. امفنت بهذا الشأن أظهرت التزاماً لا يلين في دعم المجتمعات المحلية وتعزيز قدراتها في مجال الصحة العامة، واليوم أصبحت الرسالة أكثر إلحاحاً مع تزايد وتيرة الكوارث والأزمات. هذا المؤتمر جاء ليوفر منصة غنية لتبادل المعلومات والمعرفة والخبرات حول أفضل الممارسات في مجال الصحة العامة، واليوم مع جلسات نقاشية وورشات عمل تطبيقية نسهم في إثراء المعرفة ونعالج قضايا الصحة العامة معاً. السيدات والسادة الحضور الكريم، حان الوقت لنقف معاً في صف واحد مستلهمين من قيمنا وأخلاقنا ومتسلحين بالعلم والمعرفة لنواجه هذه التحديات بعزيمة لا تلين ولنحول هذه الأزمات إلى فرص ولنبني معاً مستقبلاً أفضل وسبلاً للمضي لذلك. إذا نستهل هذا الحفل بتقديم الدكتور مهند نسور المدير التنفيذي للشبكة الشرق أوسطية للصحة المجتمعية امفنت، يتناول الدكتور في كلمته الافتتاحية الأهمية العميقة لهذا الحدث الهام ودوره الريادي في مجال الصحة العامة. فلتتفضل مشكورا دكتور.
السلام عليكم ورحمة الله وبركاته. مندوب صاحب السمو الملكي الأميرة منى الحسين، معالي وزير الصحة في المملكة الأردنية الهاشمية الأستاذ الدكتور فراس الهواري المحترم، أصحاب المعالي والعطوفة والسعادة والذوات المحترمون، أصحاب الوفود الكرام، الأخوة والأخوات والزملاء الأفاضل، تحية طيبة وبعد. لقد سرنا في العالم وفي الإقليم في السنوات الأربع الماضية نحو طريق التعافي من جائحة كوفيد-19، لنجد اليوم أنفسنا أمام تحديات جديدة ومستجدة واستثنائية زادت من تعقيد المشهد الصحي الإنساني العالمي، إذ أننا نشهد في الإقليم أزمات إنسانية غير مسبوقة في كل من غزة والسودان، إضافة إلى تفاقم لبؤر أزمات طال أمدها في أفغانستان وسوريا واليمن وغيرها الصومال، والتي بدورها أدت إلى تراجع الأنظمة الصحية وتعطل القدرة ولو جزئياً أو حتى شبه كلية على تقديم الخدمات الصحية الأساسية، وزادت من معدلات الهجوم على العاملين في القطاع الصحي، وأدت إلى انتشار الأمراض الغير سارية والسارية وحالات سوء التغذية وتدهور مستوى الصحة النفسية. كما أن هذه الأزمات والتداعيات المصاحبة لها تسببت في تراجع كبير في مكتسبات صحية التي تحققت في السابق، فعادت أمراض كانت قريبة من أن تستأصل، إذ بات شلل الأطفال مؤخرا يهدد أطفال غزة والدول المجاورة لا بل العالم أجمع، وبات النظام الصحي في السودان على شفا الانهيار. ولا يخفى على أحد أننا بتنا نشهد في إقليمنا والعالم أجمع تسارعا ملحوظا في التغيرات المناخية التي دون شك أصبحت تشكل بشكل مباشر على صحة الإنسان وبيئته، فكثرت الظواهر الطبيعية المتطرفة كالجفاف والفيضانات والأمطار الغزيرة وموجات الحر الشديدة، إذ أن هذه الظواهر شأنها شأن الأمراض السارية لا تعترف بالحدود الجغرافية ولا تفرق بين بلد وآخر، فهي تهدد كل البلدان بغض النظر عن حالتها الاقتصادية والاجتماعية والسياسية. حقيقة لم تعد التهديدات الصحية مقتصرة على حدود بلد دون الآخر، بل تعدتها بسهولة، خصوصا مع تزايد حركة السفر والهجرة واللجوء والتجارة العالمية. ويأتي جدر القرود يضرب لنا مثالا حيا حاليا على ذلك، حيث تحول من مرض محلي إلى وباء عالمي في وقت قياسي، مما دفع باللجنة العالمية المختصة إلى الإعلان عنه كحالة طوارئ قصوى. وقبله عادت الكوليرا إلى الكثير من بلداننا التي كانت قد خلت من هذا المرض بعقود من الزمن، كما تم تسجيل حالات جديدة من أمراض منبعثة ومستجدة في الكثير من البلدان على المستوى الإقليمي والعالمي. وعلى الرغم من تلك التحديات التي تخص الأوبئة والجوائح، إلا أننا لا نستطيع إغفال الجانب الآخر من الصورة الوبائية المتمثلة في ازدياد انتشار الأمراض الغير سارية أو غير السارية، وانتشار وتفشي آفة التدخين، وانتشار معدلات وحالات السرطانات المختلفة، إضافة إلى ظهور وبائية البدانة والسمنة المفرطة نتيجة للتغذية غير السليمة وتبني الأنماط والسلوك الغير الصحية والبعد عن الأنشطة البدنية والرياضية المختلفة، والتي بدورها أدت إلى تفاقم التحديات الصحية التي يواجهها الإقليم. الضيوف الكرام، يعد تعزيز صحة الأم والطفل عاملا أساسيا لتحقيق التنمية المستدامة وضمان المستقبل مستقر ومزدهر للمنطقة. يرتبط هذا التعزيز ارتباطا وثيقا بتحسين مستويات المعيشة ودعم النمو الاقتصادي والاجتماعي. تتجلى أهمية صحة المرأة والطفل في تحقيق أهداف التنمية المستدامة من خلال خفض معدلات الوفيات والمرضى الوفيات بين الأمهات والأطفال وتحسين جودة الحياة. وبعد الاستثمار ويعد الاستثمار في صحة الأم والطفل وسيلة فعالة لدعم تحقيق الأهداف الأخرى مثل القضاء على الفقر والجوع وتعزيز التعليم الجيد وتحقيق المساواة. وللأسف تسببت النزاعات والحروب والصراعات في إقليم الشرق المتوسط في تأثيرات جسيمة على الأمومة والطفولة، حيث تؤدي إلى تدهور الأوضاع الإنسانية والنفسية والاقتصادية والاجتماعية، مما يزيد مرة أخرى من معاناة الأمهات والأطفال ويعوق تقدمهم نحو حياة أفضل. لا يفوتنا أيضا أن نذكر أهمية معدلات المرض والوفيات المرتبطة بمقاومة مضادات الميكروبات. فجميع هذه التحديات سالفة التنكر وأكثر تجعل هدف تحقيق التغطية الصحية الشاملة أمرا صعب المنال، خاصة في البلدان ذات الدخل المنخفض والمتوسط. أصحاب المعالي والعطوفة والسعادة والضيوف المحترمون الضيوف الكرام، في خضم هذه التحديات تجلت القوة والإنجاز في واقع الملتقى، فقد حققت العديد من البلدان إنجازات ملموسة، حيث شهدنا إعلان العراق استكمال المرحلة الانتقالية الخاصة بشلل الأطفال. أما جمهورية مصر فقد قطعت شوطا كبيرا ورياديا على المستوى العالمي في مكافحة التهاب الكبد الوبائي سي. وبالنسبة إلى سلطنة عمان فقد تمكنت من القضاء على انتقال عدوى فيروس نقص المناعة البشري والزهري من الأم إلى الطفل. وفي خطوة مماثلة أصبحت المملكة العربية السعودية الدولة الرابعة في الإقليم التي تقضي على التراكوما المسببة للعمى كمشكلة للصحة العامة. وأخيرا أعلنت منظمة الصحة العالمية أن الأردن أصبح أول بلد على مستوى العالم يتحقق من القضاء من مرض الجذام، حيث تعد هذه الإنجازات الرائعة وغيرها من الدول المختلفة معلما هاما يمثل حقيقة مهمة في جهود الصحة العامة في الإقليم، وتشهد على الالتزام السياسي القوي للدول المختلفة، وكذلك تشهد أيضا على فعاليات استراتيجيات الصحة العامة المتبعة لتحقيق هذه النتائج. ولا زلنا نشهد في بلداننا بلدان الإقليم تكثف من جهودها لتعزيز التعاون الإقليمي أملا في مواجهة تحديات الصحة والصحة العامة المشتركة. وتسعى هذه البلدان من خلال تبادل الخبرات والمعرفة وتعبئة الموارد البشرية والمالية وبناء شراكات قوية مع النظراء والشركاء الإقليميين والهيئات الدولية إلى بناء استجابات مشتركة أكثر فاعلية وتعزيز القدرة على التعامل مع الأزمات الصحية المستقبلية بمختلف أنواعها بطريقة منهجية وفاعلة. وتأتي هذه الجهود الإقليمية والإنجازات الملموسة في إطار مسائل وتوجيهات عالمية أوسع نطاقا. فقد شهد العالم هذا العام اجتماعا تاريخيا لدول الأعضاء في منظمة الصحة العالمية، حيث تم اعتماد تعديلات جوهرية على اللوائح الصحية الدولية، مما يعكس إرادة المجتمع الدولي في تعزيز المساواة والتعاون والتضامن في مواجهة التحديات الصحية العالمية. كما تجري حاليا مفاوضات مكثفة لإبرام اتفاقية وبائية عالمية تهدف إلى استخلاص الدروس والعبر من الأزمات الصحية السابقة وبناء نظام صحي أكثر عدالة ومساواة ومرونة وقدرة على الاستجابة. أصحاب المعالي والعطوفة والسعادة والجواب المحترمين والضيوف الكرام، لم يعد خفيا على أحد بأن هذه التعاونات والشراكات تثبت أن التضامن عامل أساسي يمكننا من مواجهة التحديات وتجاوز الصعاب. وأننا في شبكة الشرق الأوسطية للصحة المجتمعية امفنت نفخر بمساهمتنا النوعية والفاعلة في الجهود المنصبة في تعزيز الصحة العامة على المستويات المحلية والإقليمية والعالمية، وأننا كشبكة رائدة في مجال التدريب في الوبائيات الميدانية نسعى جاهدين على الدوام لدعم سبل البحث العلمي وتعزيز الاستعداد والجاهزية للاستجابة للطوارئ الصحية والمساهمة والتضامن مع الجهود الصحية العالمية، وبالتعاون والتنسيق. ونسعى جاهدين أيضا لتطوير منهجيات مبتكرة لبلورة الجهود النوعية لتعزيز الصحة العامة لتدريب وتطوير الكوادر الصحية بشكل عام والشابة منها على وجه الخصوص. ونقدم دعما قويا ونوعيا لبرامج التحصين في الجهات المختلفة من إقليمنا الحديث، كما وإنما هو منطلق استراتيجي نؤمن بأهمية تبني تطبيق نهج الصحة الواحدة بشكل فعال. وبفضل هذه المساهمات وغيرها كان لنا شرف نيل جائزة البرنامج الخاص بمنظمة الصحة العالمية في مجال الرعاية الصحية الأولية لعام 2022 كمستفيد من فريق عمل الأمم المتحدة بين الوكالات. إننا اليوم نعي تماما لأن التحديات التي تعترض سبيلا في مجال الصحة والصحة العامة لن تزيدنا إلا قوة وتماسكا نحو تحقيق صحة أفضل لكافة مجتمعاتنا. ولا يفوتنا في هذا الحفل الكريم باسم شبكة الشرق الأوسطية للصحة المجتمعية وباسمي شخصيا وطواقم العمل في الانفنت أن نتقدم إلى وزارات الصحة في الإقليم والشركاء والجهات الأخرى الداعمة بالشكر الجزيل والامتنان على روح التشاركية والتسهيلات التي قدمت لإنجاح التعاون المشترك خلال 15 عاما ماضية فيما يخدم الصحة والصحة العامة في إقليمنا الحديث. ولا يفوتني هنا أيضا أن أتقدم إلى كافة الوفود المشاركة بالشكر الجزيل لإصرارهم على المشاركة رغم المعيقات والالتزامات الأخرى، مجسدين بذلك صورة ثنائية جميلة في علاقتنا الممتدة والتي تعد نيشانا على صدورنا نعتز به. هذه العلاقة التي زادت قوة بين انفنت وكافة بلدان الإقليم ممثلة بوزارات الصحة التي نعمل معها سويا وعن قرب، إضافة إلى الجهات المعنية والوزارات الأخرى والهيئات ذات العلاقة والمنظمات غير الحكومية على اختلاف التخصصات. وكما نتقدم بالشكر والامتنان للمملكة الأردنية الهاشمية ممثلة بالشريك الرئيس وزارة الصحة وللتسهيلات النوعية لإنجاح هذا المحفل العلمي، وكذلك جزيل الشكر لجميع مؤسسات الدولة وغيرها اللي يضرب بالأردن مثلا في حسن الاستضافة والإضافة وتظهر المكانة الإقليمية المرموقة للأردن وتعكس صورة الأردن كمنارة علم ووجهة نوعية في شتى المجالات المهنية والعلمية. ومن هذا المنبر فإننا نتطلع إلى أن يبقي ضيوف الأردن على الرغم من الأنجلة المزدحمة وقتا ممتعا والاستمتاع بالأردن الجميل في كافة وجهاته المتميزة. واسمحوا لي في هذه المناسبة أن أتقدم بخالص الشكر والتقدير للجهاز التنظيمي واللجان العاملة التي بذلت جهدا استثنائيا في إنجاح المؤتمر. لقد كان العمل الدؤوب والتفاني من الجميع مصدر فخر وإلهام لنا جميعا، وأخص بالشكر والتقدير الدكتور ماجد دميل نائب المدير التنفيذي للإنفنت ومدير البرامج الصحية الذي قاد هذا الجهد بكل إخلاص وتفاني، وكل الزملاء الأعزاء الأفاضل الذين ساهموا بوقتهم وجهدهم في إنجاز هذا الحدث الهام. بفضل تعاونكم وإخلاصكم نجحنا في تنظيم هذا المؤتمر الذي يمثل خطوة كبيرة نحو تحقيق أهدافنا المشتركة. وختاما مرة أخرى أود أن أتقدم بالشكر الجزيل لراعية الحفل صاحبة السمو الملكي الأميرة منى الحسين المعظمة، وإلى جميع أصحاب المعالي والعطوفة والسعادة والدوام، ولكم جميعا على حضوركم ومشاركتنا حفل الافتتاح لمؤتمرنا الثامن المتمنيا بالحضور، ولكم جميعا مشاركة مثمرة ومفيدة تخلد في الذاكرة علامة علمية فارقة في مسيرتكم المهنية الغراء، ودمتم بخير.
جزيل الشكر للدكتور أنصور على كلمتها القيمة التي سلطت الضوء على جوانب هامة في مسيرة تعزيز الصحة العامة والتأهب للأزمات في المنطقة. إذن أيها الحفل الكريم، لطالما تصدرت امفنت مشهد التصدي للأزمات في المنطقة والجهود المبذولة لتعزيز الصحة العامة في إقليم الشرق المتوسط. نستكشف معا الجهود عن قرب ونشاهد هذا الفيديو الذي يسلط الضوء على جزء من الدور المحوري الذي تؤديه الشبكة في بناء أنظمة صحية أقوى وأكثر قدرة على مواجهة التحديات. نتعرف على قصص النجاح والإنجازات الكبيرة التي حققتها امفنت ومجالات عملها العديدة. فلنتابع هذا الفيديو معا.
The Eastern Mediterranean Public Health Network, emfnet, is an organization that was established in 2009 to realize a vision: better health and well-being for people in the Eastern Mediterranean region, the EMR. emfnet is pursuing a strategically defined mission to prevent and control diseases by supporting the public health workforce, conducting operational research, strengthening public health programs, and promoting knowledge exchange and networking, while working with partners and collaborators. emfnet works with 15 countries within the EMR and collaborates with over 30 renowned entities from the region and across the globe, and has been making important contributions to better health in the region in many areas. That's emfnet at a glance. Now let's explore emfnet's journey and achievements. emfnet was established to support and expand applied epidemiology capacities in the region and to strengthen health systems across various areas of public health. Over the past 15 years, emfnet has established itself as a prominent member of the global health community, serving public health systems in the EMR, a region characterized by its complex health profile. The region is home to countries of varying socioeconomic levels. It is a region grappling with a double burden of disease, hosting refugees and internally displaced populations, and burdened with severe health disparities, limited resources, and both human-induced and natural disaster. In 15 years, emfnet has made its mark in this region and beyond. emfnet's presence spans 15 out of the 22 countries making up the EMR, with its headquarters in Jordan and a total of 7 country offices. Beyond the region, emfnet has also established a strong presence in Bangladesh, collaborating with diverse partners to advance public health there. emfnet collaborates with countries in the EMR to catalyze public health improvements by identifying needs, challenges, and gaps, while also mobilizing global health partners for support. Its local partners include health and agriculture ministries, whilst global partners span NGOs, academic institutions, UN agencies, and more. Through these partnerships, it fosters a network of expertise, facilitates global reach, and introduces innovative solutions and evidence-based interventions for regional and global health challenges. These collaborations are structured using different mechanisms. emfnet possesses expertise in areas key to the betterment of health. These areas include capacity building for organizations, communities, and individuals in a range of knowledge areas and practices. Technical assistance, data management, monitoring and evaluation for programs, projects, and initiatives, as well as its ability to provide digital solutions for public health services, interventions, and activities. Translation and localization services to break language barriers and ensure knowledge sharing. Using its expertise, emfnet serves public health through a set of focus areas. Workforce development. emfnet designs, implements, and supports needs-based training courses and programs in various disciplines. Its commitment to this area has yielded significant achievements, including leading online learning initiatives for public health in the EMR, establishing the International Academy of Public Health, supporting the establishment of new FATPs in various modalities, launching the emfnet electronic library, designing the public health empowerment program, providing training in a range of public health disciplines. emfnet supports ministries of health in the main components of public health program planning, including design, planning, and implementation. Here, Infinite's focus is on priority needs. To eradicate polio and improve routine immunization, Infinite is working closely with expanded programs on immunization to improve access and quality of vaccinations, create demand for immunization, build the workforce's capacity, improve data quality management and use, strengthen evidence-based decision-making and the functionality of national immunization technical advisory groups. To enhance emergency management, Infinite is working with EMR countries and international partners to empower rapid response teams to address emerging health crises, support public health for mass gatherings, build capacities in emergency preparedness planning, coordinate response to major emergencies. To support global health security, Infinite is promoting biorisk management through training of lab workers on biosafety and biosecurity best practices, building capacities of public health workers in infection prevention and control practices to safeguard communities against the spread of infectious diseases. Infinite is an advocate and implementer of the One Health approach. It builds the capacities of the public health workforce in One Health in the surveillance, diagnosis, and control of zoonotic diseases. Infinite contributes to the global and regional efforts and initiatives of One Health. It also works for private health integration as part of the promotion of One Health in the EMR. Infinite also supports activities for WASH and environmental surveillance to consolidate polio eradication efforts. It joins global and regional efforts in the fight against antimicrobial resistance. Infinite also supports the elimination of major neglected tropical diseases and advocates for the integration of their prevention and control into other public health interventions. To reduce the burden of NCDs, Infinite supports NCDs and mental health surveillance, prevention, management, and control. It advocates for the mobilization of support for nutrition programs, capacity building, planning, implementation, and accountability. It also promotes the health and well-being of diverse populations, including refugees, vulnerable and at-risk populations. Infinite contributes significantly to the advancement of public health research in the EMR. It builds capacities in research methodology, use of statistical software and data analysis, and scientific writing to empower researchers with essential skills. It conducts and supports public health research and generates evidence to inform policies and interventions. And it develops innovative research methods and tools. Infinite considers the protection and promotion of health for women, children, adolescents, and the elderly in the EMR a priority. Over the years, it has been focusing its efforts on refugee health, maternal health, child health, reproductive health, and management of non-communicable diseases. Connecting public health professionals within one country, across countries in the EMR, and with the larger global public health community. Infinite creates means for online and offline sharing of research, country experiences, and perspectives. It also plays an active role as a member of the regional and global networks, associations, institutions, alliances, and coalitions. Within this role, Infinite hosts a regional conference held biennially with participation from countries of the EMR and beyond. It is a member of esteemed global and regional organizations and pioneers one of the first exchange programs for field epidemiology training programs within the EMR. It founded the first internship program in public health in the region and has the longest running webinar series in the EMR. It also provides the public with access to health news through its initiatives. Infinite also develops and disseminates different communication materials such as newsletters, research digests, policy briefs, success stories, and more to advocate public health issues and increase the visibility of FETPs. And it also sheds light on other public health related issues. Infinite operates from within the region and has direct contact with the ministries of health, and this facilitates its work as it responds to country needs. It has offices in several countries of the region and has access to hard-to-reach areas in need of public health services. Its long-standing presence attests to its commitment to the region, and it has created a growing network of partners to collaborate with in providing needed support. Infinite also has a network of thousands of field epidemiologists to deploy in response to emergencies. Infinite is also driven by an important set of values: competence and excellence, evidenced by its achievements. Collaboration and partnership, demonstrated in a growing network of partners and collaborators from the region and across the globe. Accountability, which it has with the countries and international partners. innovation shown in the employment of technology and non-traditional approaches to address problems. Health equity, evidenced by working towards health for all. Emfnit is on a mission to enhance public health in the region and beyond, with eagerness to forge new partnerships to extend our reach. Join us in our journey. Together, let's make a difference.
إذا كما شاهدنا في الفيديو فإن نجاح امفنت هو نتيجة للتعاون والشراكة بين مختلف الجهات المعنية، وهذا يدل كم يعتبر العمل الجماعي خاصة في مجال الصحة العامة أمرا حاسما. عرضنا هذا الفيديو لندعو لاستلهام المثال من هذا وللعمل معا لبناء شراكات أقوى وأكثر فاعلية لتعزيز صحة مجتمعاتنا. أما الآن يسعدني أن أرحب بمندوب سمو الأميرة منى الحسين المعظمة معالي الأستاذ الدكتور فراس الهواري وزير الصحة، الذي سيلقي كلمته نيابة عن صاحبة السمو الملكي الأميرة منى الحسين وأصالة عن نفسه كرمز بارز في مجال التفاني والعمل الإنساني.
بسم الله الرحمن الرحيم، والصلاة والسلام على نبي الهدى سيدنا محمد بن عبد الله خاتم الأنبياء والمرسلين. أصحاب المعالي والسعادة واللطوف الحضور الكريم، السلام عليكم ورحمة الله وبركاته. تعزيز التأهب والاستجابة في مجال الصحة العامة هو عنوان المؤتمر الذي اجتمعنا لأجله اليوم، والذي شرفتني راعيته صاحبة السمو الملكي الأميرة منى الحسين حفظها الله بافتتاحه نيابة عنها، لما يمثله من فرصة حقيقية لتبادل الخبرات والمعلومات الضرورية لبناء استراتيجية وطنية وإقليمية متكاملة تهدف إلى تعزيز قدراتنا على مواجهة الأزمات الصحية العامة ورفع مستوى جودة الحياة لشعوبنا. وبهذه المناسبة أود أن أعرب عن سرور عميق بتواجدي معكم، وأن أشكر الجميع على مشاركتهم الفعالة التي بلا شك ستثري النقاش وتوفر أفكاراً وحلولاً استراتيجية تسهم في تحقيق الرفاه الصحي، كما وأثمن جهود الشراكة الفاعلة التي ساعدت على تنظيم هذا المؤتمر، وأخص بذلك الشبكة الشرق أوسطية للصحة المجتمعية بدورها البارز في تعزيز التعاون الإقليمي والدولي من خلال توفير منصة لتبادل الخبرات والمعارف والعمل على تطوير مشاريع مشتركة تهدف إلى تعزيز النظم الصحية. الحضور الكريم، يدرك الأردن أن ظهور الأمراض التي قد تتحول إلى أوبئة وعودتها إلى الظهور مستمران في التسارع، وأن الصحة شرط مسبق ونتيجة ومؤشر لجميع الأبعاد الثلاثة: الاقتصادية والاجتماعية والبيئية. وفي هذا الصدد نؤكد على الدور الأساسي للرعاية الصحية الأولية في الوقاية من الأوبئة والتأهب والاستجابة لها من خلال تحقيق خطة إصلاح التمويل الصحي والتغطية الصحية الشاملة، والتي أقرتها الحكومة في شهر حزيران الماضي، والتي بدأنا بتنفيذ المرحلة الأولى منها، مع التركيز بشكل إضافي على الخدمات الصحية الأساسية والصحة النفسية. وبالحديث عن الأوبئة والاستجابة لها نستذكر هنا جزءاً يسيراً من الإنجازات التي حققها الأردن ضمن استجابته لجائحة كوفيد-19، وذلك بالتعاون مع كافة الأطراف والمنظمات الأمم المتحدة، والتي من بينها إعداد بروتوكولات التشخيص والعلاج وتطوير وتحديث وبناء قدرات الاختبارات الحكومية لتمكنها من إجراء اختبارات الكشف عن مسببات الأمراض وبناء التسلسل الجيني وزيادة الطاقة الاستيعابية للمستشفيات من خلال إنشاء مستشفيات ميدانية وتجهيزها. كما كان الأردن من أوائل الدول التي وفرت عدة أنواع من لقاحات كوفيد-19 لجميع السكان، وأول دولة تقدم اللقاحات للاجئين. كما أظهرت التجربة الأخيرة حول الاستعداد لطوارئ الصحة العامة لمواجهة تهديد الكوليرا من البلدان المجاورة أن الأردن ملتزم باعتماد نهج أصحاب المصلحة المتعددين بالتعاون مع بعض الجوانب مثل النظافة والحصول على خدمات المياه والصرف الصحي الكافية، بما في ذلك الوقاية من العدوى ومكافحتها والحد من مقاومة مضادات الميكروبات. الحضور الكريم، بينما نجتمع اليوم في هذا المؤتمر فإننا ننظر باهتمام كبير تجاه معاناة أشقائنا في المنطقة، حيث تتفاقم الأزمات الإنسانية وتزداد الأوضاع الصحية سوءاً يوماً بعد يوم. إن المأساة الإنسانية التي نراها في قطاع غزة بما خلفته من قتل للأبرياء وتجويع وترويع للمدنيين وتدمير للبنية التحتية للخدمات الصحية والخدمات الأساسية الأخرى تثير قلقنا الشديد. كما نتابع ببالغ الأسى المأساة الإنسانية الأخرى الناجمة عن الصراع في السودان، والتي أسفرت عن العديد من الوفيات بين المدنيين ونزوح الملايين وانعدام الخدمات في بعض المناطق، مما كان له أثراً سلبياً على الخدمات الصحية الإنسانية. في ظل استمرار الصراعات والكوارث الطبيعية التي تعصف بالعديد من بلدان الإقليم، يتطلب الأمر منا جميعاً التعاون والتضامن لتخفيف أعباء هذه الأزمات التي تمتد آثارها إلى كل أنحاء المنطقة والأقاليم الأخرى. في الختام، أكرر شكري وتقديري لكافة جهود المشاركين في هذا المؤتمر، وأخص بالذكر الشبكة الشرق أوسطية للصحة المجتمعية امفنت ممثلة برئيسها التنفيذي الدكتور مهند نصور على حسن التنظيم والإدارة لهذا المؤتمر، وأتطلع لرؤية مخرجاته ونتائجه الهامة من برامج جديدة تتعاون فيها المؤسسات والأنظمة الصحية معا، والخروج بسياسات وخطط عمل تحقق أهداف المؤتمر. أسأل الله عز وجل أن يوفقنا جميعا لخدمة وطننا الغالي في ظل الغاية الهاشمية الخفاقة بقيادة جلالة الملك عبد الله الثاني بن الحسين المعظم حفظه الله ورعاه. والسلام عليكم ورحمة الله وبركاته.
إذا نعبر عن امتناننا العميق لمعالي الأستاذ الدكتور فراس الهواري. شكرا جزيلا على كلمتك المهيرة. الآن اسمحوا لي قبل اختتام فعاليات حفلنا هذا ندعو الدكتور مهند نصور ومعالي الدكتور فراس الهواري مجددا، والآن لتقديم دروع الشكر والتقدير وجائزة امفنت لهذه الدورة. شرفنا بالبداية نقدم درع تقدير لمعالي الأستاذ الدكتور فراس الهواري تكريما لجهوده الكبيرة في تطوير قطاع الصحة.
ديري بالك الكهرباء، ديري بالك شوي.
نقدم مجددا درع تقدير لمعالي الأستاذ الدكتور فراس الهواري تكريما للجهود النيرة في تطوير قطاع الصحة على المستويين الوطني والإقليمي. كما يسرنا نقدم درع تقدير لصديق الشبكة العزيز والقدير الدكتور هنري واك الذي قدم مساهمات قيمة في دعم برامج تدريب الوبائيات الميدانية. بفضل خبرته وتفانيه ساعد الدكتور ووك في تعزيز قدرات المهنيين في المجال الحيوي، ما أثر الجهود العالمية لمكافحة الأمراض وتعزيز الاستجابة الصحية. أما الآن نقدم جائزة امفنت لهذه الدورة التي تمنح للشخصيات التي أسهمت بشكل فعال في مجال الصحة العامة. هذا العام تم منح الجائزة لمعالي الأستاذة الدكتورة مها الرباط وزيرة الصحة والسكان السابقة في جمهورية مصر العربية والمديرة التنفيذية لمنتدى السياسات الصحية في منطقة الشرق الأوسط وشمال أفريقيا، وأستاذة الصحة العامة بجامعة القاهرة والمبعوث الخاص للمدير العام لمنظمة الصحة العالمية لشؤون كوفيد-19 في إقليم شرق المتوسط. إذن الشكر للوزير لمعالي الدكتور فراس الهواري على مشاركتنا هذه الأمسية الطيبة. شكرا جزيلا دكتور فراس. سنكون الآن مع برزنتيشن للدكتور هنري واق نعرضه برفقة الدكتور مهند السور. Can you please have a seat? إذا تكرمتم سنعرض برزنتيشن للدكتور هنري واق الآن. سنقوم بعرض برزنتيشن يقدمه الدكتور هنري واق الآن. Can you please have a seat? We're going to be presenting Dr. Henry Waugh alongside with Dr. Mohanad Mansour. If you would please take a seat so we can begin. أترككم الآن مع الدكتور مهند منصور يقدم ضيفه العزيز الدكتور هنري واق.
Colleagues, shall we start, please? We have a very, very interesting session. So please have your seats. Please do not stay in the room, either to leave or to stay. Please. We have just 2 minutes, then we can start. Please. Alice. So please let us have a seat. Please have a seat. Shall we start? I do not understand why you are leaving. You do not have a break yet. Okay, colleagues, we're almost there. It's usually, unfortunately, that we are dealing with the politicians are leaving. We have to change this attitude and listen to the scientists more than just politicians. With all respect to our politicians, usually people are asking whether the president or the minister will come. They come. If not, they will not come. So this is part of that tradition. So allow me to introduce Henry Waugh. And Henry, he knows this very well. He lived in Jordan for 3 or 4 years, and I was very lucky. Can we please do not speak up, please? Can we listen to each other, please? Please let us just to respect our guests and listen to each other, please. So I'm saying that Henry Waugh knows this system very well. He lived in Jordan for 4 years, Henry, I think, and he's very familiar with such matters. That's why he is very relaxed, and he knows the system, and he knows everything. So I know that I have officially introduced first of all Henry, then I can tell a little bit more about the Henry and why we have Henry today with us. We have Henry today with us because Henry knows our region very well. Henry, nowadays, if we introduce Henry first, then we can. So to add now, he is leading the all preparedness, response, and preparation at U.S. Centers for Disease Control and Prevention. So he is leading the whole responses, preparedness within any biological emergencies in U.S. and he's leading also the global health security efforts in terms of preparedness and response. So Henry Walk was the main and the first responsible person for responding to COVID-19 in U.S. during last hour outbreak. And of course, you know, he did many good things like Zika in Brazil and other international outbreaks. So when it comes for preparedness and response in U.S. and CDC, Henry Walk is coming the first person who is responsible for that. So we have very high top official manager or director from CDC with us this evening. In addition to that, I was very lucky to be supervised and mentored by Henry during his stay in Jordan for a couple of years. So he was my mentor, and I am very proud of this. And I keep saying this wherever I go because I was really mentored by the best of the best. So thank you, Henry. Thirdly, when it comes to Eastern Mediterranean region, it's very difficult to find a person who knows the region very well. So I remember in the past 20 years, Henry Walk was traveling around the region. So together, as I remember correctly, we went to Pakistan more than 13 times. I see Jawad Azhar here also. And Mumtaz, you know, so he was very frequent visitor to Pakistan. Together we visited more than 2 times Yemen, of course Egypt, Jordan, a couple of times. Secretly we visited also Sudan, I think, you know, during the difficult time. So we did, you know, a lot of travel, and Henry Walk always was very close to our heart, not only in science aspect, but also being with us, eating with us, learning with us, visiting us. So Henry Walk is really the closest to our region, and he is not only our friend in person, but also he is a very good friend to the region. And always when it comes in at the, of course, you know, Henry Walk is very high linked to Bangladesh as well also. So we have different aspects of this relationship. And always, you know, so far when I am traveling around the world, you know, always Henry carry our agenda with him and make sure that he's supporting our efforts in the region and elsewhere, you know, to best of his capacity. So thank you very much, Henry. And we are very honored and privileged to have you today with us. And Dr. Henry is going to present us very important topic related to the emerging threats. Are we ready? And again, the readiness is under his responsibility. So he will be within 20 minutes trying to answer these questions. Then we can open the floor for more discussion for another 20 minutes. Thank you very much. Henry.
Okay, well, well, thanks everyone. It's a pleasure to be introduced by my friend, Dr. Mohammed. It's a pleasure to be here this evening. Pleasure to come back to the region after such a long time, though I was here about 5 years or so now. I see a number of people I know in the crowd tonight, so I feel very welcome to be here. We thank Your Excellencies, the Minister, distinguished guests, delegates, colleagues, and of course friends, and maybe some new friends along the way after we finish this conference today.
I also want to thank the Imfinet and the organizing committee for putting this on tonight. So as Dr. Mohammed said, I'm coming from the perspective of a U.S. government employee, I'm a CDC employee. I've worked at CDC both in global health and domestic health for about 23 years. I still look very young, I think. And I spent some time in the region, both here in Jordan and trying to work in multiple countries, trying to build good epidemiology capacity, surveillance capacity, biostatistics, a number of different, in response to outbreaks, a number of different areas of public health. But I wanted to share with you tonight how CDC is preparing for emerging threats by focusing on public health core capabilities and continuing to update our threat assessments. I humbly present what we within the U.S. government, within CDC, U.S. CDC are doing, hoping that some of it will resonate with you. Certainly we're coming out of the COVID response and the Mpox response, and H5, for example, and now oral push in South America. And we continue to learn and update every day. So I hear Dr. Mohammed says I have about 2 hours here to talk, so I'm going to sort of lean into that right now. 20 minutes, okay. So first I just wanted to reflect for a moment. Certainly our reality has been transformed significantly since COVID-19. COVID-19 within the U.S. revealed gaps in our public health readiness, particularly around workforce and data. We had a lot of silos in our data and very outdated infrastructure, and of course in laboratory capacity. In the U.S., we're also and still working through a context of precaution fatigue. Don't do this, don't do that, be careful. And fractured trust, really, between public health and the community that we serve. It's a cliche, but it's true. We live in an interconnected world, and unchecked outbreaks cost lives, they strain resources, and deplete, and really strain our systems. So preparedness remains crucial, really moving from a static preparedness posture, we all talk about we're prepared, to a more readiness posture. We're at the starting line, ready to surge our laboratory, ready to surge our workforce, ready to transform our existing public health systems and immunizations, for example, or biostatistics, into systems that actually can help us for the next threat. Response is a whole of society endeavor, and the work must be grounded in people's actual experience. We at CDC have been challenged and criticized that we're too academic. We live in an ivory tower, and we're not connected to the people. Our guidance is not connected to the people, and that's something that we continue to try to work on and communicate more to the communities we serve. So what are these threats we need to be ready for? From a public health standpoint, emergencies can include naturally occurring threats like hurricanes, earthquakes, and flooding, and heat. Certainly heat, from a climate change perspective, is one of our biggest issues now. Biological threats can include those emerging respiratory diseases like SARS-CoV-2 or bacterial zoonotic vector-borne diseases like Zika or dengue. And they can be accidental, like chemical spills or laboratory accident. They also can be deliberate, like acts of terrorism or conflict. So how do we prepare and be ready for these threats, for all of these different types of threats? Well, a strategy is to assess the likelihood. What's the probability of that threat within that particular country, within that particular province, within that state, within that particular county? What's the probability of the threat? And then try to prevent through various measures, vaccination, good biosafety, biosecurity, and then prepare. We know there might be flooding in Bangladesh, for example. We know there might be earthquakes in certain countries in the world. We know that hurricanes, for example, will be in the Caribbean every year, so let's prepare for those. And then we try to rapidly respond to mitigate the impact. We had a Marburg outbreak in Equatorial Guinea a year or two ago. So it was new, never been seen before, and both Equatorial Guinea and the world tried to immediately respond to keep that Marburg outbreak from then becoming bigger through West Africa. And then we need to help those affected communities recover from the event. So we don't know exactly what the next step will be, but we need to focus more on public health core capabilities. So these are CDC's core capabilities. It may not be your core capabilities, but these are some areas that we are thinking about where we need to strengthen. Since we don't know what the threat will be, we need to be ready, and to be ready, we need to basically strengthen and transform our core capabilities. So we're investing in a diverse workforce at CDC, so we can, probably our workforce is the most important part of our whole response. We're pursuing real-time reporting of essential data from multiple sources into integrated surveillance systems. We're also working to improve our labs to make sure that the highest functions, the highest levels of science and quality. And we can apply these types of capabilities to respond to outbreaks at their source, so that prevent the expansion of the threat. We also have a lot of work that we're doing in partnership and collaboration with multiple countries outside the US. So we're trying to help those countries, along with the US, build that strong public health infrastructure so we can be adaptable, resistant, coordinated, and better prepared. So I just want to focus in on a couple of areas here. One is public health workforce. And so I'm going to lead rapid response to outbreaks at their source, as Dr. Mohammed says. I lead an office at CDC that's responsible for readiness and response. That's the lens in which I'm coming from. When I think about core capabilities, I'm thinking about how we can utilize these core capabilities to respond to outbreaks. So our staff, as I've said, is probably our most important asset. You know, during COVID, within CDC, I don't know about within your countries, but we had difficulty staffing our response. We had a huge response in the US government. We had about 2,500 people within the IAM structure at any one time at the height of the pandemic. But we had trouble deploying our staff internal to CDC efficiently. We had ad hoc volunteers and people rotating out every few weeks, and which caused really havoc in maintaining relationships with our state and local partners and with our external partners. Also, for the first time, we actually, during COVID, as many of you, it was affecting our families, it was affecting our staff. So our staff who were responding also had family members at home who were affected, or family members who were dying. So it's very, very difficult to staff a response during a pandemic. So what do we do to respond to that? For years, for decades actually at CDC, we've been responding on this sort of volunteer basis. 200 to 300, maybe 500 people respond to everything. So we decided we're 12,000 strong, 12,000 people at CDC. Everybody at CDC is a responder from now on. After COVID, everybody's responding. When you are hired within CDC, that's part of your job description, you're a responder. And so we created these cadres, 15 cadres. Some of them are here. We said that we're going to have a response group, a communication group, a leadership group, a global migration group, a health equity group, an epidemiologist group, a laboratory science group, 15 of them. So we are assigning people based on their qualifications and their background to these various cadres. We make sure they have training on incident management systems, for example. And then when an event happens, we put everybody on alert and say, okay, here's a big event. Here's a new respiratory illness, H5N1 circulating. We're concerned. Be ready. And so when we need you, when we need to surge, you'll be ready and you'll come on to our response for 2 to 3 months at a time. So we have about 3,000 people that are now enrolled in the CDC Ready Responder program, and eventually, over the next couple of years, we'll hope to qualify, train, and enroll all 12,000 actually into these cadres. On the global side, we're doing quite a lot of work with a number of you. We all probably familiar with the FETP program. A lot of people here trained with an FETP or know about it. Many are graduates. There's a severe worldwide shortage of skilled epidemiologists. And this program is training thousands, literally thousands of people around the world responding to multiple different outbreaks. Responding today, we have African CDC FETP graduates responding to the Mpox response in Central Africa. We have FETP graduates responding within this room, actually, to events in the MRO region. So thank you for your service. I also want to highlight on the laboratory side, the Global Laboratory Leadership Program. You know, we used to have this thing called FETP and FELTP, and we're always trying to figure out how to get closer to the laboratory science, the laboratorians. This is a great program. It's a leadership program targeting staff and human animal health laboratories, as well as other laboratories with public health impact, such as environmental, agricultural, food, or chemical laboratories. And basically, it's mentoring these emerging laboratory leaders to build and strengthen and sustain national laboratory systems. There's about 370, 400 people who have participated and graduated from this program. So very happy, very pleased that we have a laboratory leadership program that CDC has been supporting. And then you heard Dr. Mahan talk a little bit about emergency management. We actually have been working in emergency management, public health emergency management area for a while. We bring people to the U.S. for about 12 weeks and train them. And we have 27 participants in the last cohort, trained about 300 people. But more importantly, we're now moving that training actually to the region. So a number of different regions everyone's excited, especially after COVID. What's emergency management? How do we do it better? How do we set up EOCs? How do we train our people so we can respond more effectively? So we, among many others, are actually engaged in training fellows in public health emergency management. So let me just move on to data. So a major challenge during COVID and many responses at CDC and a huge opportunity is the data piece. We're in the middle, as you know, of a data revolution. A central challenge during the COVID response for us and public health at large is to take vast amount of data delivered at different times, different channels and methods like fax, paper, various platforms, systems, pull that all together at different levels, and that information at different levels of quality and completeness, and turn it into something that's useful and actionable. We have data coming in from healthcare facilities, from the community, from the private sector, many different types in the U.S. at least of healthcare organizations. So we are advancing, trying to pull all this data together into one system. And we're seeing some progress. Electronic case reporting, in the U.S. at least, and I think in some other countries, when you had a notifiable disease, basically the clinician would report and they would go to public health and they would fill out a case report around hepatitis B or whatever the reportable disease was, and then that would go into public health. Now, there's electronic medical records, and so within electronic medical records, you instantly are reporting to public health. And we started in COVID in the U.S. We only had around, I think, 187 healthcare facilities doing electronic case reporting. And after COVID, we now have over 40,000 facilities in all of our states reporting, and probably another 100,000 or so to go. But we're making progress. We're moving away from paper and fax to actually electronic case reporting. We also, during COVID, built an immunization data lake. We pushed out COVID vaccines, as many of us did in this room, but how do we know, how do we capture that administration data? Who was vaccinated, who was not, when were they vaccinated, and how do we connect that actually to outcomes? How do we connect vaccination or no vaccination to hospitalization and death, for example? And so that was and that's a vaccine effectiveness, basically. And so we had trouble connecting those two pieces, the administration part of vaccination with the outcome part, the impact part. And so we spent some time creating these immunization data lakes and figuring out who was vaccinated and who wasn't, so we can actually capture the information about COVID vaccines were 90% effective. So we spent a lot of time trying to improve our immunization administrative data so we can make those connections. Another thing we did was, as I said before, different types of data are coming in: cases, hospitalizations, death, sequencing data, laboratory data from all over. And how do we pull that type of information in and make it useful for not only CDC, but other parts of the federal government, but also other parts of our state and locals? So we designed, with some help from the private sector, a common operating platform. It's a Palantir-based. It doesn't have to be that particular company, but it's basically pulling this type of information into one data system, integrating it, and then we can create these dashboards and visualizations that we can make available for all of our partners. So we had one source of truth that everyone was working on. How many cases are there of COVID? How many cases are there of mpox? Actually, we had one source of truth, but we're pulling all that information in and verifying it. Okay, this is just a fancy graph of some of what I just said. So in the US, at least, and I think in many countries, we're working on trying to update our data through data modernization efforts. And so think about this as pipelines of data flowing in from hospitals, from public health, from the laboratory side of the house. We're trying to create standard ways of looking at that data. Everyone's collecting similar variables, so we have similar types of information flowing in from various states on laboratory and cases and hospitalizations and sequencing. So that's the pipelines are coming in. We created this in the middle here, our response-ready enterprise, which is a common operating platform. We're pulling all that information together so then we can visualize it. And then at CDC, we have a new group called the Center for Forecasting Analytics that basically can take that information, a common source of truth, and think about what's the forecast and what's coming next, what's coming in 2 weeks, what's coming in 4 weeks, what is that new COVID variant, what impact is that going to have? So we're improving our pipelines of data, integrating them into one system, and then multiple partners, including our forecasting partners, can take that data, common source of truth, and utilize it and present it to the public. Okay, let me move over to the, let me go back actually. Here we go. I wanted to move over to the laboratory side of the house. CDC, we have a lot of labs, a lot of laboratory scientists, 1,700 actually, in fact, and 200 labs. But as some of you may have seen, or that we had trouble actually early on in the COVID response. We put out a COVID test that didn't work, and we lost time. And why did we do that? Because we weren't standardized in the way we were approaching laboratory assay development across our agency. We had multiple laboratories within CDC who had different ways of ensuring laboratory quality, not one way. And we didn't share externally with other partners to assess our quality. So initially, I think the Germans put out a COVID test, WHO picked it up, we put out a test ourselves. Our test, when it went out, had trouble with quality. Test positivity or false negatives, false positives, and we had to pull it back. And then we updated and pulled it and put it out again. And we were behind by about 3 weeks. So what did we do in response to that? Well, a number of things. One is that we decided after COVID that we couldn't work independently like this anymore. We had to work within a one agency approach to laboratory quality. So we put in test review boards, for example. Every new assay that's developed within CDC goes to the test review board, actually is shared with some other high quality labs outside of CDC to ensure that it meets the standards that we desire. And then we put out this laboratory assay. We also had twice a year external reviews of all of our labs, including clinical, surveillance, and research labs. So a number of lessons actually learned from COVID. Just wanted to give you this example of some of the ways in which we're working. Some of you in this room are very familiar with influenza surveillance. So the same systems we use for tracking seasonal flu viruses are also capable of providing early warning for novel viruses, for example the new H5N1. Well, not new, it's been circulating in birds for a few years, but now actually we see them in cattle actually in the US. So how do we assess, how do we pick up a novel influenza assay? We use our seasonal surveillance actually for influenza to pick up something that's novel. So we have multiple patient specimens tested in clinical labs. Then we have another group of 100,000 specimens, for example, on this slide, that are tested in public health labs. And then we take some of those and we do full genetic sequencing and characterize those. And then we determine if our current tests actually are good enough. And we determine if our antivirals actually work. And we determine actually if our candidate viral vaccines actually work against these new novel viruses as well. So this is actually what happened in 2022. We detected H5N1 circulating in wild birds. There was a lot of concern that the medical countermeasures that we had, do they work or not? And so we were able to capture multiple events around the country, these H5N1 viruses, and then characterize them and show actually our tests do work, our vaccines do work, and our antivirals also work. Just to make a point here, CDC is working in a number of different countries, and PEPFAR, which is supporting working in the HIV world, during COVID, we leveraged actually that large laboratory system used to test for HIV to test for COVID. So those PEPFAR supported investments in laboratory networks and systems on this slide in Africa, for example, served as a backbone really for COVID-19 diagnosis and surveillance in many countries, including in some countries in the Middle East as well. So I just want to focus a minute on the work that we're doing globally. My focus, actually, in the work that I do at CDC, I used to work in global health on the global health side. I spent about 11 years there. I've been spending a lot of time actually on the U.S. domestic side, trying to think about how we as the U.S. government actually are prepared to respond. But we do continue to have this very, very large global presence with over 60 different country offices in multiple parts around the world. We have regional offices, and we have some representatives here, headers here. And we continue to work in a collaborative way with these countries to build out that public health infrastructure that we've been talking about. This slide didn't come through very well for some reason. I'm not sure why, but it looks like it's in a different language other than English. But this is a new global framework that we put together, and I'm going to walk through it for a second. So domestically, I've told you we have these core capabilities that we're working on. Globally, we're working with countries in a similar way, working on things like data and surveillance, and laboratory, and prevention and response, and workforce, very similar in innovation. And what's happening now at CDC is that we're trying to think through, okay, here's our goals, here are these areas that we're working in, these pillars. How do we measure with countries that we're working with that we're making progress? How do we measure that we have our workforce is ready to respond? How do we measure that our laboratory systems within any country that we're working in, including the U.S., how do we measure that we can surge appropriately for that, or create a new assay within 100 days or so? So these are some of the metrics that we're working on now. Okay, move to the next thread, and I only have a couple more slides for those of you who are worried. So what's the next thread? We had COVID, SARS-CoV-2, Mpox, H5N1. It's still a threat today. Or Poosh is a virus, emerging virus, for example, in South America that you may hear more about. But what is the next threat, and how do we prepare for it? Within the U.S. government as well, and again, I'm trying to give you examples from the U.S. government side and hope that some of this resonates with some of the difficulties or maybe some of the challenges that you have. And Dr. Mohammed was being very nice, saying, I know the region well. I know the region, but not as in depth as you do. So I want to be humble here and say, this really is what we're doing within CDC, and anything we're doing in other countries is really in this collaborative way. So within the U.S. government, our director, Dr. Andy Cohen, said, how do we prioritize our work? We've got a lot of work going on here at CDC. How are we prioritizing our infectious disease work? What's more important, Ebola or Nipah, or measles, or Marburg? And we only have limited amount of resources. So how do we decide the investments in the next year or two that we CDC are going to make in this space? How do we decide about what we're going to work on to protect national security in the U.S., for example? How are we making those decisions? Now, different countries do this in different ways. WHO has a way of doing this, but it all sort of comes down to a similar approach, which is looking at likelihood. So if we're looking at infectious disease pathogens, what's the likelihood of an epidemic or a pandemic? And how do we know the likelihood? We can look at things like on this slide, incidence rate or emerging rate or attack rates. What's the potential for spillover, for example? What's the potential for this particular virus to cause an epidemic or a pandemic? But we also need to look at health consequences. So what's the case fatality rate? And also, do we have effective control measures? We know, for example, that some of the things we're worried about from a bioterrorism threat, like anthrax, we actually have a lot of medical countermeasures. We actually have antivirals, we have antibiotics, we have vaccine. For influenza, we're not that concerned. We have We have vaccines, we have laboratory assays, for example, we have antivirals. But for Nipah, we don't have a lot of medical countermeasures. So if we were going to rank this, we'd probably rank Nipah a little higher. So medical countermeasures, and do we have something to control a particular pathogen is one of the things we work on. So we have an approach, and we came up with 16 different priority pathogens based on these criteria, and some weighting and a lot of arguing in a lot of different rooms. And we came up with a list. Now it's 1 versus 2, 1 versus 5 doesn't really matter. It just says within these 10 or 16 pathogens, over the next couple of years, we're going to build out laboratory assays. We're going to build out medical countermeasures. We're going to build out our data systems so we actually can capture the information that we need for those particular pathogens. But at the state level, they do a similar, within the U.S., the state level, they do a similar process. And they conduct we call it a jurisdictional risk assessment. And they, on the left-hand side here, they look at probability of a hazard. Is it very likely or none? And the impact on humans, infrastructure, services, catastrophic or minimal. So they rank these various hazards. And this is bigger than infectious disease. This is related to earthquakes and floods and tornadoes and infectious disease. Because we know the threats actually in the eastern part of our country are really quite different than the threats in another part of our country in the south. In Texas, they have flooding and hurricanes. They don't have this problem in the middle of Nebraska. But in Arizona, heat is a huge issue right now. And so if we're going to look at our threats, if I'm looking at the jurisdictional local level, I'm thinking, what am I going to put my resources towards? And so this is a framework in order to do that, looking at the probability, the likelihood of the threat, and then looking at the consequences and do we have actually adequate mitigation or not. Okay, so I'm going to wrap up here and basically say, once again, I guess my big point here is we don't know what's coming next, but we do know that we need to continue to work on our core capabilities. And that includes workforce and laboratory and our data, and our ability to do an outbreak response, and on a global side to make sure we continue to maintain this interconnectedness that we have as a public health community. Because a threat actually in the MRO region, a threat actually here in Jordan, it may emerge, could affect the whole region, could affect the world. And we want to stay together and communicate as a public health community. So I'd love to talk to you more and hopefully have some good questions. It's a real pleasure to be here. Thank you. This is my last slide.
Please, if any of you have any questions for Dr. Henry, Dr. Henry Wong.
So I'm Jawad Asar, and I was US CDC resident advisor in Pakistan for over 12 years, more than 12 years. And first I want to thank Mohanad to invite Henry to that meeting, because if I look at the whole CDC people over the years, I can't find anyone else who has facilitated the AMRO region FATPs as much as Henry did. So all of us who are sitting here today are indebted to Dr. Henry Wong. As a FATP branch chief, he supported Pakistan FATP to that extent that we were able to do many things which were not common in FATPs. We started the disease surveillance system, we started to work in polio eradication as an FATP, not as some different program. We set up disease surveillance system, we set up Sentinel lab surveillance system, and that was only because we had a big supporter at US CDC. And I think I should also acknowledge Bassam, who has also been long-term supporter of FATPs in the region. So he's here too, somewhere. He looks younger every year, so that's a challenge for us.